Welcome to COVID-19 and your weight. This is part of the virtual health talk series that we're offering. Since we can't come to you in person, we'd like to come to you remotely and the more comforts of your home. There will be a Q&A session at the end of this talk. You'll be able to see at the bottom of your screen, there's a Q&A button. If you click that, that's where you'll be able to type your questions for our panelists. If you so choose, you can choose an anonymous selection, so your name will not appear in the Q&A. We will be recording tonight's talk. For anyone who wants to see this afterwards or share it with friends or family, you will receive a link. It takes about a week for us to turn in that around. We'll have the recording hosted on our website, so you can go and watch the video, and you'll receive that link in an email and be able to share it with friends and family as well. Getting started tonight, we have three special guests. Dr. Lena Caton, who's a professor of surgery at the Case Western Reserve School of Medicine and is part of the University Hospital's Digestive Health Institute. She's the director of the Metabolic and Bariatric Nutrition Center, as well as the Esophageal and Swallowing Center. Dr. Caton attended Case Western Reserve University, where she also went to medical school. And later, Dr. Caton did a fellowship in minimally invasive surgery at Vanderbilt University Medical Center. She sees patients at Geauga Medical Center and Cleveland Medical Center. We also have Katie O'Boyle, a certified nurse practitioner. Katie did her undergrad at Tennessee State University and her professional education at Kent State University, as well as LaTanya Four, who did her undergraduate and professional education at Ursuline College. Again, thank you for attending tonight. Dr. Caton, welcome. Take it away.
Thank you so much, Mark, and really thrilled to be with you all here this evening, and appreciate your attention. And we're going to talk about a topic that's very pertinent right now, COVID-19. It's all around us. We're learning to live with it. The world is different now than it was 6 months ago. And we're learning more and more about how COVID-19 is affected by weight and how your weight is affected by COVID-19. So we're going to spend the next hour reviewing a lot of this. Through my portion of the presentation, I'm going to go through with you a few facts about COVID, how outcomes from COVID are affected by a patient's weight, and we'll talk a little bit about weight gain during COVID, because obviously, because our lives have changed, that has become a challenge for many of us. And then my partners here, LaTanya Four and Katie O'Boyle, are going to go through some weight loss options here at UH and talk to you in more detail about some lifestyle changes that we can all make to be healthier. Many of you are familiar with a lot of these statistics. These are just some of the latest statistics updated yesterday. Within the United States, 6,786,000 confirmed cases of COVID and over 200,000 deaths. Within the state of Ohio, 145,000 cases with over 4,000 deaths. And if we look at the hospitalizations, over 14,000 hospitalizations. And as I mentioned, there have been a lot of deaths, but fortunately, if you look at the trends toward the right side of the screen, we can see that a lot of these numbers are starting to drop. If we look at our census here within UH, you can actually see that we did hit our peak. We had a couple of peaks first initially when COVID first started, and then in May, and then in mid-July following kind of the Memorial Day weekend. But fortunately, our numbers are down at very, very low levels, with most of our hospitals throughout UH having very few patients at this time. So I think within our state, we're doing a really good job of staying safe. So what does our weight have to do with COVID? Well, I wanted to start with this study, which was one of the first meta-analyses looking at this topic. There have been a lot of case series out there discussing COVID and outcomes and risk factors for worse outcomes with COVID. And what this meta-analysis did was put together 26 studies, and they came up with 399,000 patients and came up with the following conclusions. 113 percent of people who were obese were 113% more likely than people of healthy weight to actually land in a hospital. So that in itself is a very scary number. And of those people who came to the hospital, if patients were obese, they were 74% more likely to be admitted to an ICU and almost 50% more likely to die or to succumb to the disease. And these are very, very scary numbers, particularly knowing that obesity is a preventable disease. And I think the overwhelming conclusion is that BMI is an independent risk factor for severe effects of COVID-19. Now, what is BMI? BMI is body mass index, and this is how we determine how overweight a person is. So normal weight is a BMI of 18 to 25. Overweight is a BMI of 25 to 30. And then anything over 30 is considered obese, and anything over 40 is considered severe obesity, used to be called morbid obesity. If we look at obesity rates within the country, this is just a map off the CDC website that any of you can look up. And you can see that about half the country is orange, a little over 30% obesity. Colorado sticks out as 20% obesity. And then there's only a few states that are dark red, which is greater than 35% obesity. But then look at this map from 2019. Ohio is surrounded by dark red states and greater than 35% obesity. And if you actually go to this website on the CDC website, they do say obesity may increase the risk for severe illness as it relates to COVID-19. So these warnings are starting to become more prevalent. In fact, on their website, they say it does increase the risk of severe illness, as was seen in the study I shared with you. It may triple the risk of hospitalization due to a COVID infection. It's linked to impaired immune function, decreases your lung capacity, risk of death increases. And also, we know that in some studies, obesity may be linked to lower vaccine responses for many diseases. And we'll talk about that more in some of the upcoming slides. First of all, overweight and obese Americans spend at least $700 more a year on medical bills than those who are not overweight. And that is over $93 billion a year in extra medical expenses. And you can see how some of those costs are distributed in that table to the right. Obesity is responsible for a lot of health problems that many people may suffer from, including high blood pressure, high cholesterol, diabetes, sleep apnea. And many of these problems are preventable or even go away as patients lose weight. There are many cancers that also are associated with obesity, including breast cancer, kidney cancer, uterine cancer, esophageal cancer, even colon cancer. You can see many of these are very prevalent cancers in the United States. And so again, if we lowered obesity, a lot of these cancers also might decrease, but they're all on an upward trend. And in fact, in this article that was just published in JAMA just a few days ago, there are some very sobering statistics that obesity is even reaching rates of 40% in some populations within the United States. So these numbers are staggering. Another sobering statistic in this study showed us that 77% of nearly 17,000 patients who were hospitalized with COVID-19 were either overweight or obese, and obese patients comprised about half of those patients. So again, these are very scary numbers, and we know that high blood pressure is a risk factor for worse outcomes with COVID-19, and high blood pressure is often associated with obesity. And this study came out of England, so this is not just unique to America. We're seeing this all over the world, so that as patients' BMIs went up, and this was looking at 334,000 patients, you can see that the hospital admissions per 10,000 people showed an upward trend as we got to stage 2 obesity. Now, why does this happen? Well, we know that COVID attacks blood vessels. this is something that we're learning as we're learning more and more about this disease. We also know that patients who suffer from obesity also have increased inflammation within their body. So if we look at many of the inflammatory mediators within the body, such as cytokines or immune modulators, that those inflammatory hormones are elevated in obese patients. Obese patients are also at higher risk for clot formation. Some people might call it sticky blood. And again, we know that COVID attacks the blood vessels, and if you have that sticky blood, you're going to have more problems with this disease. And this is also combined with a weakened immune system. So a lot of the immune factors are actually decreased because the inflammatory factors are increased. And I touched on vaccines earlier, and there's several studies that have shown that even if someone is vaccinated, if they are obese, they are twice as likely to get the flu compared to normal weight individuals. And so we're learning that this may be the factor with COVID as well. And unfortunately, many of the studies that are being done with many of the vaccines are excluding patients who are obese. So we may not have a lot of data on this for a long time, or we may need to have vaccine trials in obese patients to get a better sense of how the patients are going to do with this disease or how the vaccine will affect them. So what's our solution? Well, I think it's overall to be healthier, and that's what we're here to talk about a little bit today. Exercise, of course, is very important. It's important to make good food choices and eat healthy, and Tanya and Katie are going to talk to you more about that. Of course, wearing a mask, washing hands, I think these are core things to health in general. Also important to get enough sleep, learn to cope with stress, as this whole situation has been very stressful for many people. And so stress also kind of increases how all of this, how the outcomes go. And then of course, losing weight. The great thing is that if you lose weight and get back to a healthier weight, that patients who are obese can take their risks of having those poor outcomes back to that of healthy weight individuals. Also, the other thing that we've seen during COVID is that many people have complained of weight gain during COVID. And this is also something we're going to talk more about as we go through this session today. People attribute this to being at home, working from home, stress of kids doing virtual school so they have less time for exercise, stress just in general, dealing with COVID and not being able to go out as much. Many of the gyms are closed. And we also have sedentary jobs, lifestyles, less activity. So there are several factors contributing to this weight gain. And again, my colleagues, LaTanya and Katie, are going to talk to you a lot about how to mitigate that and how to fight that problem. There are many treatment options for obesity that we separate into kind of medical and surgical treatments, and you'll hear a lot more about this from LaTanya. And there are several medications on the market now for weight loss, and Tanya and Katie's going to talk to you about a lot of those and how they work and how they might be helpful for different people. So in conclusion, COVID really leads to worse outcomes in obese patients. It and can be very, very scary, but we do know that that can be reversed. Getting to a healthier weight can reduce those risks. And now I'd like to bring in my colleagues. I think Katie O'Boyle is next. She's going to talk to you about some weight loss medications for weight loss. And then Tanya is going to go through all the options that we have here for weight loss at UH, as we have a lot of different programs and offerings for people who come to UH. And then I'll be back at the end for questions. Thank you so much for your attention. I'll pass it over to Katie.
Hi, thank you, Dr. Kaitan. I am just going to share my screen. There we go. Okay. Let me just get the PowerPoint up. Okay. Hi, everyone. As Dr. Kaitan said, I'm Katie O'Boyle, and I'm one of the nurse practitioners in our comprehensive weight management program at UH. And tonight I'm going to talk with you about our medical weight loss program, what it entails, what medications are available, and how effective they are in managing obesity and weight maintenance. Although diet and exercise are key components in any weight loss program, sometimes to achieve maximum weight loss results, we have to add in extra tools. Medical weight loss programs, ours especially, offer individualized solutions that are designed to optimize weight loss. So if you've been struggling during COVID, and Dr. Ketan just talked about the increased risks related to obesity, there are options that we have here at UH that can help you to combat that problem. So in essence, we at UH provide a comprehensive approach to obesity health by incorporating dietary counseling, exercise recommendations, and then adding in weight loss medications when appropriate to help facilitate weight loss. So what qualifies someone for medical weight loss? As Dr. Ketan talked about, we rely heavily on the BMI scale. So again, that is the body mass index, which is a relationship or a value based on an individual's height and weight. So specifically talking about medications for weight loss, if your BMI is 30 or greater with or without a weight-related health problem, such as diabetes, high blood pressure, you may qualify for weight loss medications. Or if your BMI is 27.5 to 29.9 with a weight-related health problem, you may qualify for weight loss medications. So for weight loss medications, there are several medications currently on the market approved by the FDA for the treatment of overweight and obesity. These medications, however, are to be used as an adjunct to diet, exercise, and lifestyle modifications, which I feel is one of the biggest reasons for seeking out a weight management program, because you're getting that comprehensive approach to obesity health. The decision to start weight loss medications will be made after a thorough review of your individual health status, past medical history, BMI, and consideration of risks and benefits of use. Also, expectations for weight loss medications will be clear upon initiating any drug therapy. So goals of therapy, and the first one is always everyone's main goal, and that's weight loss. But the others are also extremely important. I know Dr. Ketan had mentioned a lot about comorbid conditions or those weight-related health problems. And we see a significant reduction, if not resolution, in these health problems when we have weight loss. So that's improvement in your diabetes or hemoglobin A1C, improvement in blood pressure, high cholesterol, joint pain, etc., which leads into the next point of improvement in quality of life. And we see patients who see improvement in all kinds of qualities of life. So going on a roller coaster for the first time or sitting comfortably on an airplane seat. And these are really big achievements for people when they get there. And then one of my most important goals is the longevity of weight maintenance. So we view obesity as a chronic problem. It's not a quick fix. And what our goal is at UH is to not only help you achieve your weight loss goal, but to maintain that weight for the long term. So the longevity of weight maintenance is really there. With regards to medications for obesity health, there are pharmacologic options that are divided into two groups. So we have short-term weight loss medications and long-term weight loss or weight maintenance medications. And I'm going to talk a little bit about both of those categories. So for short-term weight loss medications, there are several that are FDA approved for short-term use. So that means 12 weeks duration or less. The first one is, I would say, probably the most common or well-known, phentermine, Adipex, or Lomera. Same medications. Lomera is a little bit lower dosage. And what these medications are central nervous system stimulants or sympathomimetic drugs. And what they do is kind of give a boost of energy to help, motivate for exercise and increased physical activity, as well as decrease your appetite, which helps you to maintain a calorie-restricted diet. Diethylpropion or tenuate is also a sympathomimetic drug with pharmacologic properties similar to amphetamines. So you have that little boost of energy, the decrease in appetite. And the bensphetamine and phendimetrazine are both also sympathomimetic drugs with pharmacological properties similar to amphetamines. Their mechanism of action in reducing appetite actually appears secondary to central nervous system effects. So this includes the stimulation of the hypothalamus in the brain, which releases norepinephrine and helps to decrease your appetite and improve energy. So sometimes people get through 12 weeks of therapy, medication therapy, and maybe they're not quite at their goal weight, or maybe they're just not quite ready to, quote, go on their own. So again, I had mentioned that we view obesity as a chronic problem, and thankfully it's becoming more widely known as such. So they're developing more medications to help patients with long-term weight loss and weight maintenance. So those are the medications I'm going to talk about next. And the first one is Saxenda, or liraglutide. And this medication is a glucagon-like peptide 1, or GLP-1. Now, GLP-1 is a native hormone that is released in response to food intake and acts as a physiological regulator of appetite. So Saxenda works also in the hypothalamus of the brain, and it helps to regulate appetite and food intake. It also increases the feeling of fullness or satiety, and therefore decreases hunger. It also has beneficial effects on glycemic control. So it's very helpful in patients who have metabolic syndrome. It can be used in patients who have diabetes and patients who do not have diabetes. I will say in patients with diabetes, not only does the weight loss help, but the GLP-1 also helps to reduce their hemoglobin A1C and to help them get better control of their diabetes. Next is Contrave, which is a combination of naltrexone and Wellbutrin. So an opioid antagonist is naltrexone, and a weight-negative antidepressant is Wellbutrin. And this medication is believed to work on two important areas of the brain, the hunger center and the reward center. So it therefore reduces hunger and helps to reduce cravings. So it gives you a little bit more willpower and the ability to stick with a healthier diet that doesn't get, that you don't get a lot of cravings for these favorite foods that you have. Next is Qsymia. It is also a combo medication. So it adds in one of those sympathomimetic drugs, phentermine, and also an anti-epileptic drug, topiramate or Topamax. And Qsymia promotes the stimulation of the sympathetic nerves and can suppress appetite, which then decreases food consumption. Qsymia also can affect the neurotransmitter GABA, which suppresses appetite and enhances satiety or the feeling of fullness. And last is Orlistat, or Ally, and this is a lipase inhibitor. It reduces the activity of lipase in the intestine, and lipase is secreted by the pancreas when fat is present. So the role of a lipase inhibitor is to reduce the gastrointestinal absorption of fats. Orlistat has also been shown to have benefits with regards to glycemic control, lipids, and blood pressure. So that's a lot of information about medications, and I'm sure you're wondering, okay, these are great, but how effective are they? How much weight am I going to lose? So with regards to the short-term medication or those sympathomimetic drugs, remember they reduce food intake by decreasing your appetite. So research studies do support that weight reduction in patients receiving short-term weight loss medications was in fact greater than patients managing with diet and exercise alone. In fact, one trial showed a difference of weight loss of about 16 pounds in patients taking medications versus about 4 pounds in patients not taking medications. With long-term medications, specifically we'll talk about Saxenda first. Based on current studies, the majority of patients treated with Saxenda achieved and maintained a clinically meaningful weight loss with a difference from the placebo group or patients not taking the medication. And these differences were deemed statistically significant. With Contrave, across 3 studies, patients who added Contrave for a full year lost approximately 2 to 4 times more weight on average than those not taking medication. The combination of Qsymia has shown to enhance weight loss as evidenced by multiple clinical trials. In fact, in a 52-week study, the mean total weight loss was significantly better in the group taking Qsymia versus the group not taking Qsymia. And with orlistat, the efficacy or effectiveness of orlistat in helping to facilitate weight loss has been demonstrated in several randomized clinical trials and meta-analyses. In a meta-analysis of 12 trials that included patients with or without diabetes, patients randomly assigned to orlistat plus behavioral changes lost about 11 to 22 pounds as compared to 6 to 13 pounds in the placebo group, or those not taking orlistat. So that's a lot of information, but what that information shows us is evidence-based research that supports the effectiveness of weight loss medications when combined with diet and exercise. So before I turn you over to LaTanya, I just wanted to remind you all that obesity is a chronic problem, and it's one that you don't have to go at alone. Losing weight is definitely a personal choice, and at UH, we're here to support you throughout your entire weight loss journey, whether it be surgical, medical, or non-surgical. We're here for you now during COVID, and we'll be here long after. So with that being said, I'm going to turn you over to LaTanya Four. She's one of our senior nurse practitioners in our program, and she is going to talk with you more about obesity health and the offerings we have here at UH. LaTanya?
Thank you so much, Katie. I will go ahead and share my screen here to pull up my presentation. All right. All right, so I'm LaTanya Four, senior nurse practitioner here at University Hospitals of Cleveland in a comprehensive weight management program with Dr. Katon and Katie Boyle. And I'll be speaking mostly on weight management strategies in terms of eating behaviors and exercise to sort of help you in managing your weight during the COVID pandemic and beyond. So I know what you're thinking. You know, we just heard from Dr. Katon in terms of all of the complications and all of the sort of scary health problems we can deal with as we deal with obesity and with the COVID-19 pandemic. And then we also heard from Katie in terms of the weight medications or the weight loss medications we can take in order to sort of get some of the weight off. But with that being said, I think it's important that we lay the foundation for how we should eat, not only during COVID-19 and but beyond. And so after speaking with some of the patients, a lot of the patients that I've talked to during our appointments and our visits, you know, they tell me, I'm really struggling. I put on weight. I'm stressed out. I'm working from home. You know, LaTanya, give me some tips. How can I get over this? Help me out here. And so these are just some of the eating strategies that I like to share with my patients. And then hopefully you will find them helpful as well. So first of all, I like to tell people, I think you have to become familiar with knowing the difference between what hunger is and what cravings are. Hunger is sort of a feeling that you get, and it builds gradually. Okay, you will notice a sensation really starting in the back of your throat before you start feeling it in your stomach. And you know it's hunger if it's been at least 2 hours in between meals, as opposed to a craving, which is something specific. So I have a craving for a cookie. I have a craving for a piece of cake. That's the difference between hunger or true hunger and craving. So getting to know the difference between those will help you in the long run. You also want to pre-plan your meals and your treats. If you notice, I'm working from home now, I'm really stressed out, the kids are homeschooling, actually create a plan, preferably the day before, in which what you're going to eat for each meal, and then you stick with that plan for the entire day. Also pre-plan your treats so you can get a handle on how often am I having those treat meals, how often am I eating in between meals. If it's something that is planned out, you're likely to stick with it. Grocery shop smart, which means actually create a list before you go to the grocery store to prevent any impulse buying, and stick with that list. Now, a lot of stores have curbside pickup, and so that'll also help you in preventing impulse shopping at the grocery store. That was actually one tip from my patient. She started using grocery curbside pickup because of COVID-19 and trying to prevent being in large crowds. And by just making a list online and then picking it up curbside, she noticed that she was able to prevent some of the impulse buying, walking down the candy aisle in a grocery store. Do a meal makeover. So I tell my patients, work on one meal at a time and make over that meal to be a sort of healthier meal. So if you are the type of person who likes, say, a meat and a starch and a vegetable for your dinner, maybe you want to add in 2 vegetables and take away the starch. If you say like pasta for dinner, maybe try taking out the white pasta and adding in like a whole grain pasta. That's what I consider to be a meal makeover. Just say no to binge foods. Now, this is an area where I even personally struggle with. Okay, so what I tell people is, if you don't buy it in the store, then you only have to say no to it once. Because once it's in the house, it's calling you all day long, all night long. It's calling your name. But if you don't bring it in the house, you are likely not to be thinking about it. Most people won't actually leave the house and go to the store to buy it. And so just say no to those binge foods. And those binge foods are those foods that you likely are going to eat outside of the recommended serving size for. So say like potato chips or popcorn or peanuts. Those things are real easy to overeat on. Just don't buy it. And then you should do better in terms of saying no to it. Protein, protein, protein. So this is a saying that we have in our bariatric surgery program, but I think it actually is beneficial for those who have not had bariatric surgery, because protein gives us a feeling of fullness and satiety. And so if every meal is built around protein, it's particularly about 20 to 30 grams of protein, or about 5 to 6 ounces of meat at every meal, then you will have a feeling of fullness. You'll be able to sort of stretch those meals a little bit farther. And this will help you in preventing some of those cravings and that eating in between meals. Pre-plan your portions of produce. Try saying that 10 times, right? But basically what that means is you build your meals around vegetables and fruits. Okay, those foods are higher in volume and lower in calories. And if you actually plan your meals around that, you will not only get in the recommended servings of vegetables a day, which is at least 5, if not 9 servings of vegetables, and you will get a better control over your weight and be able to maintain your weight. And then lastly, water, water, water. Water is life. And so the body is going to send you the same signals of thirst as hunger. And what you think may be hunger or a craving could actually be thirst. It's recommended that we all get in about 60 ounces of water, or about 5 bottles of water a day. And so if you notice you're really struggling with hunger and cravings throughout the day, have water first. As a matter of fact, have at least 8, if not 10 ounces of water before a meal to see if that really is going to help you with those hunger and cravings. All right, so physical activity tips. So COVID-19 has certainly changed the way in which we would normally exercise. If you were an avid gym goer, the gym was one of the first places that was closed down. Now that the gyms are back up, there are still quite a few people out there who are not comfortable with actually going back into a gym. I think you can do both. I think you can go back into a gym and be safe. Wear a mask, socially distance, wash your hands, don't go in if you're sick, and use hand sanitizer, wipe the machines down if you wanted to actually go back into a gym at this point. But if you don't, these are just some tips that I have sort of come up with to still help you get that physical activity in and help you maintain your weight. So get creative. You know, now's the time to try all sorts of new things out there, right? We're just coming into the first days of fall here. It's, you know, high 60s, low 70s outside. Go outdoors. The Cleveland Metro Parks, Cleveland and Ohio, Northeast Ohio, is known for its metro parks. Check one out. There's beautiful trails out there. Go out there and walk, pick a buddy. You guys can wear masks and socially distance and get some exercise outside. Try live stream classes. So especially if you sort of weren't all going to classes in person, this is the time to try something new. Maybe you always wanted to try Zumba or kickboxing or Pilates or yoga. Now's the time to try it. You know, nobody's going to judge you. You're just streaming with the class. If you need to take a break or stop, no one will be able to really see you, or if they can, turn the camera off and go take a break. But there's plenty of programs, plenty of facilities that offer the same classes in person, online as well. YouTube has a lot of resources on there that are free, so you don't have to worry about actually paying and having memberships of some great exercise program. My personal favorite is Leslie Sanson, Walk Away the Pounds. It's literally walking in place. She's teamed up with the American Heart Association to walk for, I think she has 1 mile, 3 mile, 5 miles. So just walking in place inside, before you know it, you've walked the distance. So YouTube has a lot of resources on them. Smart TV applications. So again, the same programs you can sort of get on YouTube. If you have a smart TV, you can pull up those apps, exercise apps, and try out anything you sort of been looking into trying. And then activity trackers. So I personally use a Fitbit to track my steps. It's a great motivator. It kind of keeps you on track. They say about 10,000 steps a day is about equivalent to about 5 miles. You can join in with your friends to make it a little competitive. So to me, this is a great time to get creative, to get active. and think outside the box. If you, like I said, if you want to go back to the gym, you can do it safely. But if not, this is a great time to try something new. All right, so, and just what are the benefits of physical activity, especially in terms of COVID-19? Physical activity actually increases your immunity. So it's very important in terms of building and maintaining your immunity to prevent actually contracting the virus and even the flu as we enter into the flu season. Physical activity can boost your mood. So a lot of us are struggling with depression, we're struggling with anxiety. Like I said, we have a lot going on here. So just getting out, getting a walk in, getting some physical activity actually help boost your mood. And then physical activity also helps you build muscle. And muscle helps your metabolic rate. And so just getting that activity in, getting that exercise in is going to help you in a variety of ways. These are just 3 reasons that I've put up here. There are multiple reasons on why we should get physical activity in. But to kind of put it into perspective in terms of COVID-19, I think these are probably the 3 important that we should keep in mind. And then lastly, behavior modification. How can behavior modification help us in weight loss and help us in weight maintenance? So self-monitoring and goal setting. Self-monitoring in terms of keeping food journals and keeping food diaries, actually writing down or electronic food diaries to help you stay accountable, help you know how many calories am I getting in, where am I getting extra calories, and it kind of just brings to light, you know, what you're really eating, and it helps you make a better choice. Do I really want to spend 300 calories or so on that candy bar? And I really do look at it like spending, almost like a budget. I call it a calorie budget. What's my calorie budget for today? Do I want to spend those calories on that? Or would I be more fulfilled with something that's a little bit lower in calories and maybe have that at another time? And so those are some apps that you can use. MyFitnessPal, Lose It, Fitbit even has a calorie tracking along with the step tracking to help you stay on task there. And then again, the activity tracking with the Fitbit, and then stimulus control, which means basically controlling your environment, not bringing those foods in that will cause you to overeat or cause you to sort of fall off track there. In terms of our weight management options here at University Hospital, bariatric surgery is indicated for those with a BMI greater than 35 with at least 1 weight-related complication, or a BMI of 40 without a weight-related complication. And we've had a previous presentation and it's been recorded, should be on the website, that talks about the different procedures in detail. There are also endoscopic procedures like the intragastric balloon, which is technically a non-surgical option, but it is, needless to say, an option for weight management. The comprehensive weight loss program that Katie sort of touched on, where we offer or can at least discuss with you weight loss medications. But I really want to hone in on the lifestyle counseling. Because ultimately, any weight management program is going to be built upon that. And that is what we really stress. Now, if you are not interested in weight loss medications, the comprehensive weight loss program still could be a great fit for you. Maybe you just want to speak to someone about maybe optimizing your own diet and exercise efforts. We can do that here at University Hospital's weight loss program. We do a very thorough medical evaluation. And in that evaluation, we go into really looking at what could have been some reasons for your weight gain. Sometimes it's medication related, and we can sort of talk about that with you. Sometimes it's related to some other medical conditions you may be dealing with. And so we can also assist you with that as well. We also help adolescents. So if mom and dad sort of gets on board and wants to help help improve their weight, maybe their children may need that help as well. Weight regain after bariatric surgery. So there may be people on the line today who have already had bariatric surgery, and maybe they're experiencing weight regain or weight SAWS. The Comprehensive Weight Loss Program at UH can help you with that. Preparation for another surgery. So maybe you're getting ready to have a joint replacement and the doctor has recommended that you lose weight. Maybe you need to have a hernia surgery, and the doctor has recommended that you lose weight. We can also help you with that. We also help women who are experiencing infertility issues. So we know that infertility is impacted by weight. And so by helping you lose weight, you can hopefully follow up with your infertility specialist and maybe have a baby. And so we can certainly help you with that. And again, like I said, in preparation for surgery, like joint replacement surgery. We also have clinical nutrition services, which are dietitians who dig a lot deeper into meal planning and meal prepping, helping you really understand how the body uses food, how the body uses protein, carbohydrates, fat, that sort of thing. Really helping you understand what proper portions are so you can meet your weight goals. There's a program called Fit or Meet, again, more so helping you with your lifestyle adjustments and coming up with a personalized treatment plan for you. The Protein Sparing Modified Fast is a program. It's a very specialized and unique diet for those, almost similar to like a ketogenic type of diet. They're low in carb, and so we have a provider who helps with that. And then lastly, integrative medicine, looking at some alternative ways such as hypnosis, which can help you meet your weight loss goals. And so again, I just really want to hone in that all of these things collectively can work together, and they should work together. So in addition to the lifestyle, in addition to the medication and the surgery, together they can help you meet your weight loss goals. And this slide just shows you here all of the different options at University Hospital based upon the BMI. But really, you can't go wrong just calling University Hospital, saying you want to be connected with the weight management program, maybe even starting with comprehensive, and we can hopefully get you pointed in the right direction and get a plan set up for you. So, so that concludes our presentation here. Like I said, I'm Latanya Ford. We have Katie O'Boyle, who's our certified nurse practitioner, and Dr. Lena Kaitan, one of the bariatric surgeons here at University Hospital. For appointments, you can call us there at 216-243-0075 or visit our website at www.uhhospitals.org/weight loss. And we hope to hear from you soon. Thank you.
Latanya, thank you. Katie, thank you. Dr. Kaitan, thank you so much for today's information. we'll go ahead and start some questions. We had a couple come through in advance, and one of the questions we received was the person has trouble with belly fat and keeping that off. So what would be some easy recommendations for trying to keep belly fat off?
Well, I'll let Katie and Tanya
I-
probably address that.
I'll take that question, Katie. So I get that question a lot in clinic. People come into the office, especially women. We tend to struggle with that particular parts of our body there and putting on belly fat. But in order to reduce belly fat, you have to lose weight overall. When you just lose weight, the body is going to decide which part of the area is going to sort of shrink those fat cells. So there's no real sort of targeting weight loss, just calorie reduction, physical activity, and overall weight loss is going to help you with the belly area.
Great, thank you. Another question that came in prior is asking about what is covered with insurance in terms of the weight loss programs. How does that usually work?
Yeah, so a lot of the services, so we have a whole plethora of weight loss services at UH, and unfortunately the insurance coverage is going to be variable. So for surgery, people have to see whether bariatric surgery is a covered benefit on their insurance. But most of what Tanya and Katie do is all covered by insurance, and they would, they would bill your insurance company just like any other provider would. As far as some of the more specialized programs like Fit or Me, the protein sparing modified fast, again, those are kind of more targeted through to different groups, and some are covered by insurance and some are not. And so it's kind of variable. A lot of the dietitian services are not necessarily covered by insurance. But we're definitely working on some of those things for you. At this point, I think a lot of those dietitian services are not billed to insurance as far as I know. But Katie, Tanya, any insight?
I feel that medications are often covered. There are some, like the short-term medications, that even if they're not covered by insurance, they're affordable if you pay for them out of pocket. So generally between like $11 and $20 for the month. There are also coupons that you can find online that make things more affordable. Some of the long-term medications are a little bit more expensive, but depending on the person's health problems, sometimes we can support the medical necessity for those medications based on both obesity and diabetes or one of those comorbid conditions.
Yeah.
Go ahead.
The coverage. Oh, I was just getting ready to say the coverage for the office visits, like Dr. Kaitan said, is we would just bill it as any other type of office visit. If you have questions about coverage for surgery, we have a whole team that'll help you with that process. And in those individual offices with those different programs, you may want to contact them to see what's covered and what's not covered. But the best way to really sort of get a feel for if it's going to be a right fit for you is to, like I said, just contact the office to get an appointment.
Thank you. Our next question is Saxenda safe for patients with diabetes and hypertension?
Ladies?
Mark, can you repeat that question? I'm sorry, I didn't hear it.
Sure. The question is Saxenda, I believe that's how you say the medication, safe for patients with diabetes and hypertension?
So we definitely base all medications, or we go on an individual basis. So it would obviously depend on the person's health status. But yes, Saxenda is actually a higher dose version of a diabetes medication called Victoza. So if I have a patient come in who does have diabetes, I will often reach out to their primary care provider or who manages their diabetes and just collaborate with them to make sure that starting Saxenda isn't going to cause hypoglycemia because they're on a different medication. But it generally is okay for giving to someone with diabetes as well as hypertension. It doesn't have as much, it's not as effective towards blood pressure as some of those other short-term medications are. So actually rely on Saxenda a lot for patients who have uncontrolled hypertension or other health problems that you wouldn't necessarily want to give a stimulant for. Latanya, do you have any other?
Yeah, when we are working with a patient, Katie and I, and we are trying to help figure out or work with the patient to figure out which medication is going to be most appropriate, we always look at the medical history and the medications that the patient is on. And when we're deciding which drug to go with, we mostly consider side effects of the drug. And so the major side effects of Saxenda are nausea, maybe heartburn, and constipation. And so it's not, you don't have an issue with blood pressure going up with Saxenda. And if there is a risk for a hypoglycemia, again, for low blood sugars, we would work with the primary or who's the patient's blood sugars.
Yes, we received clarification from the person. It said Saxenda and insulin, they're type 1.
It just depends on their insulin. And again, collaborating. And that's, I think, a big part of a comprehensive approach to weight management. So not just collaborating with our other providers and nutritionists within our program, but having a collaborative relationship with the patient's providers. And that's where, especially a brittle diabetic or a type 1 diabetic, their needs for insulin and regulating their blood sugars sometimes are a little bit more advanced. So I would definitely collaborate with their provider just to make sure. And sometimes it's as simple as just having them monitor their own blood sugar more often. And generally type 1s generally have an insulin pump so they can monitor their blood glucose pretty regularly. So it would just kind of take an individualized plan of care for that patient, but that's certainly not something outside of our abilities.
Thank you. Our next question is, I'm a 61-year-old and I find it very difficult to lose weight. Any suggestions? I'm in the lower end of the overweight category.
Yeah, I mean, we have lots of suggestions. You just need to come in and talk to us, but well, Tanya, looked like you were going to take that one. So go for it.
Well, yeah, I was essentially going to say the same thing. You're not alone. You're amongst, a lot of patients who may feel as though because I'm older, maybe it's very difficult for me to lose weight. And an office visit, a medical evaluation, we can really dig into what may be preventing you from getting you to your goal. So, but it is definitely going to start with looking at your nutrition and your physical activity.
One other question we received earlier was if you could explain the support group that happens after bariatric surgery and how it's a lifelong support for you.
Yeah, so bariatric surgery is not magic. Just because somebody has an operation does not guarantee weight loss. This is something that patients who undergo this need to think about every day for the rest of their lives. Not to say that you have to obsess about it, but it is something that you always need to be conscious of, because the surgery is a tool to help you stay on track. But ultimately, you need to continue to make great choices when it comes to activity and nutrition and providing your body with good, healthy fuel. And so we provide ongoing support groups, which through COVID, actually, we've converted to online and virtual, so anybody can join from anywhere and attend our support groups and really, get that support that they need as they're going through this postoperatively. A great reference is Al Roker's book, where he's talked about his experience with having had a gastric bypass procedure and talks about how this is a lifelong journey and the things that he faces, just so that our patients, I think that's a great reference for our patients, because I want them to know that this is not something that they're alone in. And that's the whole reason we have the support groups, to help people stay on track. Because if you do fall into your old habits, unfortunately, you may start to regain some of your weight. And so to help avoid that, we provide the support that patients need in terms of group support groups. But then patients can also have ongoing visits with our dietitians individually at any time. And of course, they can always come back to see any of the providers, whether it be our nurse practitioners, Katie, Tanya, and then our PA, Sandy, who's based out of Parma, or any of the surgeons that are within the program.
Thank you. We have another question. How do you handle folks who have long-term sugar addictions?
That is, addictions of many kinds come our way. And so, Tanya talked on how this is a multidisciplinary problem, and we try to attack these things from all different sides. So kind of the simplest answer is, well, if you have kind of that sugar addiction, use a fruit or something to satisfy that sweet. But on top of that, there are a lot of other things that you can do. Kind of when you're tempted by the sweet, you can go for a walk, or do something punitive if you actually touch the sweet to yourself, like put $1 in a jar so that you'll have money that to allow you to buy clothes when you do lose the weight or something like that. But then we can take it to the next level, where we get into interventions and get into surgeries. And after weight loss surgery, a lot of our patients' taste buds change. And so that is one other way to approach that, if your body mass index qualifies. And also sugary things, particularly processed sugars, will make most patients feel pretty sick or give them dumping syndrome after a gastric bypass procedure. So those are some of the surgical ways. And of course, then let me turn it to Tanya and Katie to talk about the non-surgical things that they recommend to their patients with the sweet addiction.
So there are some medications that do help with cravings. The one that I talked about, Contrave, does work on that center of the brain. Also, Qsymia has Topamax in it, which has been known to help reduce cravings for sweets and carbs. A lot of times too, and as Dr. Kaitan said about the multidisciplinary approach, sometimes, seeking out counseling, and we do have some psychologists and psychiatrists that work very closely with our program. Sometimes that is extremely beneficial to and helpful to patients to kind of get to the root of that addiction, because even with surgical procedures or medications, there's always the possibility of a transference of addiction. So sometimes if there's that potential for addiction, whether it be, going extreme exercise or sugars or things like that, then having talk therapy or meeting with a counselor is very helpful. But there's also, like Dr. Kaitan said, surgical options, and there's medical options as well. Latanya, do you have any other thoughts?
Yeah, you just can't buy it. That's
very good.
If it's not in the house, you can't eat it, right?
If it's not in the house, you can't eat it, and it's not calling your name. And so I you know, make a joke about it, but that if you control your environment in things that you tend or would likely overeat on, you just can't bring it into the house. So and surgery and pills for weight loss, they don't work by themselves. These are tools to help you change your behaviors, but ultimately you have to make the choice. And so the choice, while you have these tools and things, or even working with a psychologist or a mental health specialist, at some point you just have to make a choice and don't purchase it. And so that'll be probably one of the major sort of tips that'll help you there.
Okay, thank you. We are running a little over 6 o'clock, so we want to be mindful of everyone's time. So we have just a couple more questions. The first one is, any suggestions for someone with a thyroid issue? It's taken me 6 months to lose 10 pounds, and I continue my diet changes and increased exercise. I feel better and healthier, but a bit frustrated because I'd like to lose another 5 pounds. And thank you for this presentation.
Katie or Tanya, you guys want to take that one?
Thyroid dysfunction, it certainly makes it difficult for people to lose weight, and we certainly empathize with you. And that's how we take a comprehensive approach, right? Because we actually take into consideration the other medical conditions that could be preventing you from losing weight. Now, it's not going to be impossible to lose weight with a thyroid dysfunction. We certainly congratulate you on at least losing the 10 pounds. And it may just be slow for you. But working with a medical professional, working with a nurse practitioner, or with a dietitian will sort of provide you that accountability and that support when things are getting tough, when you're getting down to those last few pounds and you feel like giving up. We can tell you, you know what, hang in there. You're 10 down. You can keep going. Maybe just tweak this a little bit. Maybe increase this exercise, you know, a little bit. I find most people don't need to make a lot of changes. It's really just kind of going a couple of degrees left or right with things. And that'll kind of just move the needle in the direction that we're looking to. But know that you're in this for the long haul. Obesity is a chronic medical condition. And so you'll always sort of be fighting it. But don't give up. We are certainly here to encourage you, and we're here to support you. And yes, you can continue with your weight loss efforts.
Thank you. Our last question is, are any of you available in Western Cuyahoga County? So maybe you can share all the locations where people can find us.
Yeah, thanks, Mark. Yeah, we have offices throughout Northeastern Ohio. So we go as far west as Westlake. Parma's kind of southwest. We're soon to be opening offices out in Avon. We go down to Ashland, Portage County, all the way out east up as far as Mentor, and Geauga Medical Center at Minoff in Beechwood, and Bulwell down in downtown Cleveland. And let's see, and I said Parma. So I think that covers all of our different locations. So we spread all the way across the city. So hopefully you can find one of our offices close to you.
And we got one more in under the belt.
Thing, you know, okay, I just want to just echo Dr. Katon here and saying we're virtual now. So you can see us, if you live on the west side of Cleveland, you can stay over there and see us and book a virtual visit. So because of COVID-19, the government has loosened those telemedicine requirements. And so wherever you're at, as long as you're in the state of Ohio, we can perform at least a medical interview and evaluation right over your laptop, your tablet, or your cell phone.
Yeah,
Someone
thanks for
wanted to
pointing
know
that
if we're
out.
in Ashtabula County.
The closest to Ashtabula would be Mentor or Geauga Medical Center. We have, and then also up in Geneva, some of our providers go up there.
And our final question was, anxiety and stress are my biggest issues. What do you recommend when stress eating or anxious eating?
Finding something else to do with that energy. So start knitting or needlepoint or using your hands for something other than eating food. Go out and walk. I read a study actually that had a comparison between a group taking antidepressants or anxiety medication and a group doing exercise. And there was, in both groups, there was improvement of stress and anxiety. And this group was just doing exercise. There was no pharmacological intervention. So there is proof that using that energy, implementing, an exercise regimen, having time for yourself, that is 30 minutes a day or an hour a day, that is just for you. It will reduce stress levels. It will reduce anxiety. I always recommend finding something that you find enjoyable. So dancing or Zumba or boxing, something that you're going to want to do every day. But that is one of the best ways that you can combat stress and anxiety.
Okay, thank you so much for everyone for your time today, spending it with us this evening. Thank you, Dr. Caton, Katie, and Latanya. Any closing comments from you, ladies?
Well, I just want to thank everyone for joining, and we know that losing weight is hard. That's why we've put together a very comprehensive team that involves nurse practitioners, dietitians, nurses, psychologists, psychiatrists, and then physicians from every other discipline, so that patients can achieve their goals, because we know that this is hard. We try to offer as many ways to lose weight through UH, so that way you can go from one. If it doesn't work for you, you can try something else, so that we can get you to your goals, and we're here to support you in any way possible. So thank you again for all your attention.
Again, thank you everyone for attending tonight. Again, this talk is being recorded, and you will receive an email in approximately a week that will give you a link to find it on our website should you care to watch it again. Encourage you to reach out to us and help you with your weight loss and staying healthy during COVID-19. Thank you again for attending. Have a good night.